So hello beautiful people, it's with great pleasure that I welcome you to this special broadcast on World Thrombosis Day. I am your anchor, Akinyola Moshobalaji, and in the studio to take us through the facts about thrombosis today is Professor LeRoy Edozien of the University of Medical Sciences, Ondo. Prof, you're welcome, sir.
Thank you very much.
Yeah, Prof, can you just take us through what thrombosis is?
Thrombosis is basically blood clotting within the blood vessels. Okay. So it could be a blood clot in a vein or a blood clot in an artery. Okay. So normally there should be free flow of blood in the blood vessels. Yes, if you have a clot in a blood vessel, it blocks that blood vessel. So that's one problem. The greater problem would be that sometimes that clot could get dislodged. Okay. So if you have a clot in the leg, in the calf, and it gets dislodged, it gets carried in the bloodstream, it could go to the lungs, it could cause confusion in the heart, causing severe illness or even sudden death. So it's a serious problem.
Our statistics shows us that about 1 in every 4 person that died of thrombosis. How true is that statistic, sir?
Yeah, that's a global statistic. Okay. I wouldn't say that we have very reliable statistics here in Nigeria on death rates from thrombosis. But globally, yes, it is true that 1 in 4 would die of thrombosis. Some of these who die of thrombosis would have other conditions. For example, you could have cancer, but it's not the cancer that kills you, it's the thrombosis, which is one of the complications of cancer. Or you could go for an operation and you die not from the operation, but from the clotting complication that follows that operation. So yes, globally, 1 in 4.
Every 4. And what are the causes of thrombosis generally?
Well, first of all, anything that slows down the blood circulation predisposes to thrombosis. So if you have been hospitalized for a long time, you are in bed, you are not mobile, that puts you at risk of thrombosis. If you are seated for a long time in an aircraft or even land transport for several hours, your circulation is impaired, and again, that could put you at risk of thrombosis. There are some people who have a familial predisposition, so there's something in their family that makes them genetically predisposed to clot formation. So that would be one of the factors. And then there are some conditions, inherited or acquired conditions, that are also associated with a high risk or relatively higher risk of thrombosis, blood clotting.
Okay, and what are the preventive measures? Because looking at this awareness campaign now to really make people know about what thrombosis is, the causes of thrombosis for this year's World Thrombosis Day, what are the preventive measures to ensure that one doesn't fall victim of having thrombosis?
Well, first of all, being aware of some of those risk factors that I have mentioned. If you have a family history, then you've got to be aware of that and make that known to your doctors and take the usual precautions that are recommended. But for many people, there will be no such history. It will simply be that, for example, you've had an operation and you have not had some preventative measures, or, as I said, long distance travel and things like that. Now, so what are these preventative measures? First of all, being mobile. Okay. You go for an operation, after your operation they say you need to rest in bed. No. You need rest, but you must also be mobile, keep the circulation going. Similarly, you're traveling, after an hour or 2, you get up, you walk around, stretch your legs, and continue. Then things like hydration. Okay. You have enough fluid on board. If you don't have enough fluid on board, your blood thickens, so to speak, and you're predisposed to clot formation. And then in certain situations, you have to wear what we call compression stockings. These are stockings that help to return blood from your dependent parts, from your legs, to your heart and the upper parts of your body. So those compression stockings are important. If you are an elderly person, for example, and you have to travel, wear those compression stockings. They help you. Similarly, for those having surgical operations or other medical conditions that make them to be restricted. Okay. You have a fracture, your leg is in POP, you are well, but you could have a clot forming, which may be a threat to your life. So things like mobility, hydration, compression stockings, and for those who are at high risk or in high risk situations, there are injections or tablets, things that thin the blood and help to prevent thrombosis. So these are very simple preventative measures
that could be taken. So what are the roles of health professionals in preventing thrombosis?
Yeah, that's a very important question. Especially so here in Nigeria, because there is published research that shows that prevention of thrombosis in Nigeria is poor compared to many other parts of the world. And when you think that the preventative measures are not complicated, there's no reason why it should be so. So our health professionals need to be more aware of this condition. Our health professionals need to comply with guidelines for assessment of risk of thrombosis. When the patient comes to you for surgical operation or for other treatment, bear in mind risk assessment for venous thromboembolism and apply preventative measures as we have said. Someone has had a cesarean section, don't ask them you need to rest in bed for so many. No, get them ambulance. Fluid replacement, hydration, preventing through what we call pharmacological prophylaxis, that is giving them injections or tablets where required. So these are very, very important for preventing thrombosis. You see, it's not very nice where you have, that's to put it mildly, where you have a woman who has undergone brain surgery and everything is fine, nothing wrong with the operation. On the day of discharge, she suddenly dies. At post-mortem, you look at the site of the operation, there's no bleeding, everything is fine. It wasn't the operation that killed her. It was thrombosis, which could have been prevented. So the important message to health professionals is do your thrombosis assessment, implement these simple preventative measures, and help to raise awareness amongst the patients.
Okay. Are there specific places where persons can actually go for thrombosis evaluation or check?
Well, no, there are no specific places because it's something that should be part of routine practice at all levels of clinical care. So your patient walks in, you as part of making a diagnosis of the condition, you are assessing what their risk is of thrombosis. If somebody has diabetes, for example, and is elderly, if somebody has a history of pulmonary embolism, that's clots in the lungs, in their family, things like that. So use all those factors to assess your patient's risk. But even those who are at low or medium risk, you still employ those things like mobility and hydration and compression stockings.
Yeah, I was reading through a few documents, in preparation for this special interview, and I discovered there is a kind of correlation between deep vein thrombosis and COVID-19. That means patients with COVID-19 are kind of at high risk of having thrombosis. How trace that, sir?
It's absolutely true. There's an association between the two. In other words, if people who've had COVID, are at risk of having blood clots, in many cases that is actually what causes death or serious problems, with breathing. And I do know people who were recovering from COVID, but just when you thought they were recovering, maybe they've gone to the toilet and they've collapsed in the toilet. That is thromboembolism. So there's been a thrombus, which is the clot, and the embolus is where that clot gets carried in the bloodstream to the heart, and causes immediate death.
Okay, thank you so much, Prof. To wrap up this interview, I would like you to tell us the key message for this year's World Thrombosis Day.
The key message would be for the public to be aware. Most Nigerians would not know that this condition exists. Okay. You will hear somebody has just come back from wherever and they've collapsed at the airport, or somebody has collapsed after they've been discharged from hospital, or some sudden death that you don't know the cause of. When you look at it critically, it's going to be thrombosis. So be aware of that. Be aware of the simple measures. If patients are aware of it, for example, when they're going for surgery, they'll ask the doctor, what's the risk of me having a clot and what are you going to do about it? So awareness. That's the message this year.
Okay, thank you so much. It's been a wonderful time speaking with Professor LeRoy Edozien of the University of Medical Sciences on this year's World Thrombosis Day, and it's been an exciting and intriguing moment, having a time out with Prof. We really appreciate your presence in the studio today, Prof. And we trust that the awareness and the campaign for this year's World Thrombosis Day will get to different persons, and it will also help in reducing health and risk of contracting thrombosis. Thank you so much, viewers. That will be the size of this year's broadcast for our World Thrombosis Day. God bless you.